First, let's welcome Micky Winfree of Novant Health, Oceanside Family Medicine and Convenient Care. Welcome to the show, Micky.
Thank you very much.
Now I know you're Michael,
Yes.
but you prefer Micky. Is that correct?
Yes.
Great. Well, we're gonna call you Micky. So we're really glad to have you here on the show, and I suspect there's lots of people out there who haven't met you yet. So
there are a few, I'm sure.
Since you haven't been here all that long, so let's start out by learning a little bit about you, your education, your training, your experiences.
Well, I've been a nurse since the mid-90s. I started as an associate's degree nurse and worked my way up through the educational channels. I 2 years ago finished my doctoral education at East Carolina University.
Great.
And that was quite an experience.
I bet.
Yeah, it was pretty awesome. They have such a great focus on rural community health.
Yeah, they do.
I thought that was a very valuable experience.
We have a couple of doctors at the hospital who went to East Carolina, and actually we have several, and they're really big on rural health and community health. So it works out for everybody. When did you join Novant Health?
Well, believe it or not, it was the day before all of this coronavirus lockdown happened. So it was the 12th of March, and the 13th was when everything kind of went through the fan, yes.
So you got here just in time for coronavirus,
Absolutely,
right?
yes.
Well, I know it's going to settle down there eventually. I understand you work at Novant Health, Oceanside Family Medicine and Convenient Care.
Yes.
And that's where you have the Respiratory Assessment Center?
Yes, ma'am, we do.
And I understand that you work there in the screening process. Is that correct?
Yes, that's my predominant role currently.
Currently?
Myself and one other nurse practitioner provide that service there. We screen everybody that comes into the parking lot essentially.
Even in their cars,
Even
right?
in their car. In an effort to keep anyone that might have signs or symptoms of coronavirus outside of the office to prevent transmission to any other patients that we may have having their visits, and then we route them appropriately based on those symptoms, and then evaluate them to screen them and test them if needed.
So the RAC, or the Respiratory Assessment Center, is a little different than just going for a test.
Indeed. Indeed, there is an assessment process that happens. You will be greeted at the driveway by one of our nursing staff, and they'll ask you a series of questions, and based on your responses to those, they'll route you to see one of the providers at the Respiratory Assessment Center, or allow you to proceed into your regular scheduled appointment with your primary care provider, or if you're going into the convenient care services there as well.
Oh, good. That makes a lot of sense. Tell us a little bit about the safety measures that the staff are taking, you and the rest of the staff are taking, to ensure everyone's safety.
Well, we definitely follow the CDC and the North Carolina Health and Human Services recommendations on personal protective equipment, or PPE.
Right. We hear a lot about that now.
A lot about that. Everyone is masked at minimal level. That's even with just casual contact. Anyone that has more interaction with the patients that are at risk, we will go anywhere from mask, face mask, gloves, the full plastic garb, the full shield, and so we do everything we can to minimize risk of exposure for the staff, as well as risk of transmitting from one patient area to another.
Right. Yeah. I don't know how you keep up with all the cleaning. I mean, it's just it's a monumental task.
It is. It is something that goes on every minute of every day.
Yeah.
Pens get cleaned, clipboards get cleaned, our equipment that we use to take vital signs is cleaned, and that's in between every patient.
Man.
So yeah, it's a lot of cleaning.
It's probably the cleanest place. That's what people are saying to me. Oh, I don't want to go to the hospital. It's probably the cleanest place you can go to right now.
Could be when you need to be there. Yes.
Yeah,
absolutely.
when you need to be there, that's probably the best place for you to be. So. So when patients are experiencing symptoms of coronavirus and they come to the area for testing, then there would be separated from the wellness
Absolutely,
patients.
yeah. We do not handle any of the coronavirus testing inside the building. This is all done.
Good to know.
Currently, we are conducting this at car side. We are in the process of setting up a program to move some of that out of the car, less car side service, and we're setting up a building that can allow us to rotate people through and keep it more comfortably cool, because this heat out there is going to get bad before it gets better.
Yeah. Do you have any key tidbits for people out there how to stay safe I mean, other than,
Well, the way to stay safe is what's been pounded home time and time again, and that is mask. Wear your mask when you go. And it's not for you, it's it's to prevent you from spreading anything that you may have to anybody else. Because the problem with this virus is that we have no way of predicting who is going to have a bad outcome from it.
right,
So do your part, keep your mask on, wash your hands,
Wash
keep
your
your
hands, wash your
6-foot distance. Those 3 things alone can go a long way towards reducing the transmission of this viral illness.
and that's the reason we're not masked here, because we are 6
We
feet
have that
apart,
6 feet distance, 2 arms length, that's what it takes.
and we're the only 2 people in the room.
Yes, that,
So that makes it safe, but once we leave, we'll all be masked.
yeah, that's what I was going to say.
Are
Carry
you
mine with me.
Well, that's really good information. Aside from the pandemic, what were your role at Novant Health, Oceanside Family Medicine Convenient Care B?
Well, as soon as we get back to normal operations.
Whenever that is.
Whenever that is. I will be one of the nurse practitioners providing care at the convenient care clinic. We're open from 8 to 8. We take all manner of walk-in patients. We do everything that we can for you there, and obviously if something is beyond the level of care that we can provide in a convenient care setting, then we're going to get you into the next most logical place to be taken care of, whether that's with your primary provider right away, or if you need to go to the emergency room. We will strongly encourage that.
Right, well, great. So before we wrap up, can they schedule an appointment with you, one of our newest providers?
I do not, as a member of the convenient care team, do not accept primary care patients. So
Okay.
the answer to that is no. However, we do have several physicians and nurse practitioner and physician assistant providers
yeah.
that are accepting new patients in the office.
So the practice itself is taking new patients,
Yes,
and we can provide that number for them on the screen.
that'd be great because I haven't been there long enough to memorize it yet.
Oh, Micky, you're a delight. I'm so glad you came today.
No problem. Glad to be here.
I hope that after you have a few months under your belt, you'll come back and talk to things that you like to talk about. Any
Sure,
kind
because
of-
there are several. I really have a strong focus and strong interest in diabetes management and
Awesome.
self-education. Yeah, I'd love to have a little conversation about that.
We can arrange that. Thanks so much for coming.
Not a problem.
Great.
Anytime.